That works. All right, perfect. All right, we're live, everybody. It is Tuesday, the 19th of February, and I've got Carrie here, the man, the myth, the legend. And so Carrie just got back from Jamaica, but we've got some big plans in the works for not only this, for going live and information and things like that, but we're going to start doing some shows like this every couple of days that are going to really highlight a couple of things that that are really integral to the whole medical marijuana industry here in Florida. So we've got some plans for bringing in some dispensaries, a couple of high-powered attorneys, and we're going to make a podcast and a show out of it. So we're going to make just a big production, because bringing you guys the best information and being able to have the resources and basically the correct information about everything is really crucial. Okay, so today what we wanted to go over is basically just the differences in CBD oil and the importance of the quality and things like that. And I was talking to Carrie before this, and we were talking about basically where you get the source of the CBD oil. We were talking about the OG Kush, right?
OG Kush is the brand, the actual seed that we decided to go with. We yielded 164 strains for it. OG Kush is something that is a hybrid that we came from and we started to use. And the reason why we used a hybrid for it is because when you think about terpenes, you think about marijuana, and especially when you go into CBD oil, these are all CBD based. It has no THC in there, no THC, no THC that gets you high, nothing of the high effect. Yeah. You're not going to fail your drug test. So we thought about something that's going to be smart for us. OG Kush is the hybrid. We can yield the straight CBD strains from it. It's a very, very prominent strains. And we didn't want to pick a strain that was already known out there. For example, Pineapple Express. Many people might have seen the movie. If I would have picked Pineapple Express, I'm pretty sure the grandmas and the moms out there would be like, oh, you're getting high. Well, you're not.
yeah. There's just stigma attached to it.
Yes, sir. Yes, sir. So we tried to pick up a different brand or something that people can understand to and relate to and give us an opportunity to teach them. Not for us to think that it was just marijuana, you're going to get high. It's something that, here's our lab test. This is what we do. This is the terpenes in there. Now let's get some help.
Explain that real quick, the terpenes first. You mentioned that. What are those terpenes that you're looking for in this particular CBD?
Okay, so in our particular CBD, the terpenes looking at is something called only CBD. CBD itself is a terpene by itself. So CBD itself helps you with pain relief. It helps you with insomnia. Helps you with your... I have so many patients right now who tells me, listen, Carrie, I'm eating too much. Or listen, Carrie, I want to lose some weight. CBD can help you cut your appetite. Many people think about another stigmatism. Great word you use. That should be a word of the stigmatism. we should start picking a word of it to teach people, because a lot of people might not know what that means, and it's crazy. But long story short, a stigmatism of being with that is, I'm taking a CBD product, or I'm taking a marijuana product. I'm going to get high. Well, you're not really. The CBD itself helps you go to sleep. If you want to eat too much, people think you're getting high and we get the munchies. You're not. CBD itself in here helps you take away your pain, helps you take away your appetite. I have patients in here, if you look at our milligram, our dosage, it's crazy how we dose it. 12 to 48 milligrams a day. Mm-hmm. That could be from 6 drops to 12 drops a day. That's the difference between sleeping 6 hours and 8 hours a day.
Yeah. Well, I mean, that's the thing. Those drops are just so small too. It's a big difference. So you gotta make sure. Now, you mentioned this last time too when we were on this. You said that you wanted to focus more on the medical side rather than just legalize everything.
Yes, sir.
Why is that?
Because it's the same. Even if you legalize everything, people still have cancer. They still have anxiety. They still have depression. Yeah. So what's the difference if somebody passed the bill today, and I won't say their name. Somebody passed the bill today and said, hey, everything is legalized today. You still have to go to a bud tender and tell them, hey, I have PTSD. I was beat up as a kid, or I have anxiety, or I have AIDS, or I have HIV. You want me to go tell a bud tender that and then tell me how to get help in my day? No way. That's what HIPAA is here for. That's one thing people have to understand. Even when this goes recreational, medical officers are still going to be here, because education is forever. Knowledge is power. Yeah. How many more patients don't know? I have patients watching us right now who don't know the difference between indica and sativa. Don't know the difference between a hybrid. They get stuff off the street. Oh, this is good weed. And they wonder why they gained 20 pounds off of this strain.
Because they sit on the couch and eat.
Yep.
Yeah.
You get couch stuff.
Yeah. That's the worst part. But so, okay, going back to the CBD, we've got this OG Kush. Why what's the difference between like a CBD that you can get just about anywhere, right? Or compared to the ones that we've got?
Man, that's what we're really going to go on. I'm really happy you asked that.
Yeah.
I will be able to show a lot of more information. One is what you're getting out there in the streets. I want everybody to understand they don't know what they're putting in there. Because the reason why I tell you that is anybody could put anything on an ingredient label. Ingredients, no THC, pure CBD, isolated, MTC oil, and we fraction it off with coconut oil. The reason why we use coconut oil is because it goes down smooth. Coconut oil, and I've used this. I'm from the islands. We've used this for a long generations upon generations. That's why I put it into hair itself.
Yeah.
The difference between our products and another product, show me what other terpenes are in their products. I guarantee you with CBDDV or CBDDD, you want your people are coming to us saying, hey, I want CBD only. I don't want the high effect. But I have people out here buying this stuff off of Amazon. I got the moms buying stuff from the yoga stores and their workout gyms. And they're telling us, hey, this is a great CBD product. I got this from a yoga instructor. Who's that yoga instructor?
Yeah.
What's the difference between a yoga instructor and a bud tender? When it comes to marijuana, a bud tender might know the products, and a yoga tender, a yoga trainer might know the products too. But where's your products at? Where's your lab test at? Where are you showing me facts at?
Yeah, yeah. Well, that's the biggest thing is like, it's you have a quality difference between, it's like almost like olive oil, right?
Yeah.
Like you can literally go to Publix or Walmart and get some brand name olive oil. But literally, if you go to like Italy and you get like some local stuff, it's gonna be night and day difference.
Yep.
The terpenes, what is in this that's different from like, let's say maybe the whatever they get off of Amazon? Like what specific ones are you looking for?
So in our products, and the patients have to understand this, the only terpene, the only derivative of cannabis in there is CBD.
That's it. There's
That
nothing
is
else.
Nothing else, and that's what our lab test has. Each one of our products has it on it, and each there's over. I want everybody to understand this now. There's probably over 1,000 different CBDs, THCs, different terpenes that you can go ahead and go on a list for. That comes from that little bud of marijuana. So much different things are in that particular bud. Our products itself, we took it all out, and we only kept CBD. We got right down to the root.
Yeah, and that's the difference between everything else.
Yes,
and
you're gonna go buy a bottle of liquor. You want the Ciroc, or you want you want the little Smirnoff. You're gonna pay for your Ciroc, right?
Yeah.
Here's your Ciroc. Here's your name brand. This is what you're paying for. This is the Bentleys. This is the BMWs. This is what you pay for. And payment wise, price wise, I'm cheaper than the dispensary by far. This is 2,500 milligrams. We sell this right here for $150. You buy a 1,500 milligram bottle from the dispensary for $150.
Almost.
Our 1,500 milligram bottle is $100. Do the math on it. We're here. We're able to help.
Yeah.
What else?
Now, how much CBD should people be taking?
Okay, prime example for this right here. This is 2,500 milligrams. On the back of our dosage, it goes from 12 to 48 milligrams a day. So if we did 2,500 milligrams divided by 50, that works out to be 30 days. This would be a 30-day supply of you going to sleep for 8 hours a day. I guarantee you every one of our viewers on there will buy this.
Yeah.
I'll put you to the test. We have also smaller bottles coming out too. We're giving out for our patients smaller sample size of 100 milligrams. And you come a patient 4 hours, you get the bottle for free. You can change the bottle, the t-shirt, if you want to go to sleep, whatever you want to get done. We're able to give our products out for free so our patients can try it.
Yeah. No, I took half a milliliter a couple nights ago. I was telling you, and it knocked me out at like 8:30. So this is good stuff. Now, let's see. Honestly, I want to just take and see if there's any questions that we have on here. Okay, so we're on Instagram Live. So Facebook Live, we'll be getting to you in a second. Basically, we have, let's see, Chino Zooted. I'm 18, and am I able to get a medical card?
You're 18, you're able to get a medical card. Yes, you are. And I see Exotic Alchemy. I see you have a lot of questions for us as salesman. I would love for you to DM us and speak to me. Since it's not a terpene, terpenes, I apologize. That says terpene. Let me just show our wonderful viewer from, this is Cureleaf, a dispensary out here. That says terpene, not terpenes. Terpene health benefits. So anti-cancer, anti-diabetic, stress relief, anti-inflammatory. What are terpenes? This is a great explanation right here for everybody. And you can see, like I just told everybody, it's probably over 1,000 different terpenes. And this is just 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 15 different terpenes that our wonderful dispensary, Cureleaf, has chose to help us out and show. And as you can see, these are all THC-based terpenes. Not anything on here says CBD. So, Mr. Exotic Alchemy, I would love to be able to have a conversation with you guys anytime you like. We go on this side too. THC, CBD. Different things that CBD does for you, different things THC does for you. Anti-seizures wouldn't be a good combination for THC. That's definitely a CBD strain, as we can see on here. Terpenes and CBD is not one. Please explain, Mr. Exotic. As I told you before, CBD, CBD1 receptors, CBD2, CBD2 receptors. Are we understanding here? Again, you can always message us to have more information.
Yeah, we encourage everybody to message us. That's what we're doing this for. Sorry about that. We want to be able to communicate with everybody and have an open course of communication.
Go ahead.
Yeah, but that's pretty much it that I wanted to talk about because I just found out recently that CBD is not technically federally legal. It's state by state still, and we were having a discussion about this earlier. If I think it was Idaho, South Dakota, and Nebraska, of all places. But yeah, okay. 3
states where you can't purchase CBD, you can't purchase THC, you can't even talk about anything in those states. Yeah. I never knew that.
Yeah, I literally, because the reason why I brought this up is because there's I follow some form of motorcycle racing, and the governing body is totally getting away from anything CBD related, and I thought it was a bunch of crap, and I had to look it up, and I found out, but I got a little education over the weekend. So this is, you don't need your card for this. You can pick this up whenever you want to.
Yes, right? Sir.
So do yourself a favor, get some CBD from Green Relief. We're going to go ahead. We got just a new shipment at the Curry Ford location.
Yes, sir. Right? We got new gummies that came in. We actually did sour patches also for people who like a sour flavor. Oh, we did more tinctures for it. The jewel pods came in.
Good. Mango,
strawberry, and actual OG Kush. Yep. What else did we get? We got the lavender creams. We got the other. We did more of a grainy type substance for our actual pain cream. We did a skincare treatment. We did UV protection, suntan, sun care protection of your skin.
Dude, I need that.
Yeah. I got cotton mouth just now, but that's all products that we'll be showing out. Nice. I got dropped off there yesterday, so we should be inventorying everything today, so we should be up for sale by tomorrow.
Sweet. And now we've got the 2,500 milligram and the 1,500 milligram. How much is this one, and how much is the 2,500?
1,500's 100, 2,500's 150. We have the 1,000 milligram coming out, and we have the sample size of 100 milligrams, and each different flavor to give to our patients that they can try out if they're interested in the tincture route.
Yeah.
The gummy bears also, I'm looking to put together like a sample package for our patients.
Cool.
Whether it be like a small little 100 milligram bottle of violet tinctures, a couple gummy bears, some sour patches maybe. We have our dog treats that just came in, our CBD dog treats, which is really, really cool.
That's awesome. That's awesome.
Chicken, beef, and pork, and we're also going a vegan route. And we're also doing...
Most important.
Yeah. I think the dog treats is the best thing. That's really, really cool. I give it to my dog. I have a pit bull.
Really?
Yeah, I have 2 dogs, a pit bull and a little teacup Yorkie.
Oh, jeez.
So the teacup's a ferocious one.
Have you sampled the dog treats yet yourself?
You actually eat that shit for real.
Yeah?
Of course, if I'm going to do a product, I'm a humans eat it too.
You got to eat it, yeah.
And you have to be. And it comes with marijuana. Why
That's
not?
right. Human tested, dog tested, everything's good.
I'm put our face on it and just say, we tested out and make sure it's safe.
That's
for
right.
everybody.
Yeah, both of our faces on there. That'd be awesome. All right. Like Carrie said, if you guys have any questions, please let us know. That's what we're here for. Email us, DM us,
yes,
comment.
Our good friend, Exotic Alchemy. I would really, really like to speak to you because you are definitely speaking a lot on here, and you should message us.
Yeah. Let us know.
I love you're fired. I love the hate. I love it.
Hey,
Lab tested works out. Please contact us. I'm down. Matter of fact, just for you, what time is it? All right.
Was it 2 o'clock?
Yeah, come check us out on Friday at the same exact time. And just for you, Mr. Exotic Alchemist, whoever you are, I'm going to make sure I post up every single one of these on here with our lab test. I'm going to do a screenshot of every single one of them. And you can look at all your information you want, so then you can see it. And if you have any other questions from there, you'll contact us.
There you go. It's that easy. All right, guys. We'll be back soon, and we will have more info. All right. See ya.
Bye-bye.